My name's Rachel, and I've put together an exercise program primarily with elder in mind, meaning people 65 and older. Specifically, the exercise program is designed with modifications so that if you use a walker, this would be accessible for you for exercise. And further, most of the exercises can be done from a wheelchair. The importance of this program is to reduce falls in patients. Because falls are so common, I wanted to do a little introduction to the video and talk about some of the risks with falls. About half of all falls that occur in elderly people occur in the home. So it is important to look at your home and see if you have any fall hazards. Things to keep in mind would be making sure that there's adequate lighting throughout the house. Also, making sure that there are no items that you can slip on in the house, like loose throw rugs or clutter. Important to keep the floor clear of all clutter. Also, important to have modification devices throughout the home, so grab bars in the bathrooms and even railways in the halls. Occasionally, if you have suffered a fall in the past, you can get your primary care provider to write you a prescription for an occupational therapist to come into the home and do a home assessment. Other than that, it's also important that every time you get up out of the chair or bed, to get up slowly, because as we age, it gets more difficult for our blood pressure to adjust to changes in position. So taking time and allowing yourself to adjust before walking. Also, it's important to wear athletic shoes. Running shoes are important to be worn in the house and while doing exercise. So you'll notice in my video, we're all wearing athletic shoes. A couple of other things that are important to reduce falls is to make sure that you're up to date on your vision checks. Also want to review with your primary care provider if you're on medications, to do a medication review. Make sure that all the medications are still necessary and that there are no interactions between medications. And also, what this program is all about is that exercise has been shown to be the most effective prevention in fall risk. So staying active throughout your lifetime. And I wanted to give 4 tips for exercise before we begin the program. The first, I'm going to repeat again, is to wear comfortable athletic shoes. Also, drink some water before your exercise and after. And then make sure to do the exercises slowly. If the pace is too quick for you, just slow down and rest. If you feel pain, stop the exercise and rest. And also, if you feel dizzy or short of breath, stop the exercise again and rest. Important to remember, all exercise programs should be discussed with your primary care provider before beginning. And this program in particular is done in 3 parts, so they can be done together or alone. The first is core strengthening and also stretching. The second part is a balance routine, and the third part is a strengthening routine. So these are all loaded in 3 segments, and as I said, you can do them out of order. You can do one, take a break, and maybe then do the second. So I hope you enjoyed this exercise routine. Thank you.